I'm Robert Przybyś, I'm a reflexologist. I live in Warsaw in Poland. I'm here to present neuroreflexology and Temprana reflex therapy, the modern methods in the range of reflexology, but even the name neuroreflexology means that it's something else than classical reflexology based on Chinese medicine. So what's so special about the method I use in my everyday work? Neuroreflexology is focused on the brain, on the cranial nerves, and spinal nerves. What we can achieve thanks to this therapy is re-educate the brain and the whole nervous system. So this method can be used with great results to help children and adults with neurological and genetic disorders. This is my experience of 18 years of my work. On my website, temprana.pl, I present many films which show results of 1 year or 1.5 years of the therapy. Some of them were provided by me in my place, in my cabinet, but the rest were organized in the way that the parents were taught by me and they learned how to help their children. So this method, Temprana reflex therapy, we call it, is based on the efforts of parents. They work on the faces, on the feet and the hands of children. And usually I encourage them to work every day or 4 times a week. It depends on the case. How we could say this method is different from the other kinds of reflexology? Maybe I'm not the best person and the right one to judge other methods because I'm not using other methods of reflexology. So maybe I tried 1 or 2, but I compared with what I started with and I resigned because I observed the results are not so fast and the techniques are not so focused on neurological disorders. And this is my main interest, to help children with epilepsy, with spasticity, suffering from cerebral palsy, from metabolic diseases, and other kinds of disorders. Usually I'm asked about the biggest success that I had in the therapies. I had a few such cases. I had a child and we visited with the parents and with the child TV station. This boy, in the 2nd day of life, he lost 80% of one hemisphere of the brain. And the parents heard from the doctors that there is no hope for change. After 1.5 years, we were in TV station and the child was running around the studio and it was hard to observe that the boy has a problem with motor functions. Maybe if someone observed this boy very carefully, would notice that one of the hands was not as movable as the other one, but nothing else. After years, he went to school, he learned English, he trained karate. I met him last December. Now he's 16 years old boy, and he traveled by subway. We talked a little. He lives with many problems, with many deficits, but on the first look, you wouldn't recognize this is the problem. This is the boy with such big problem. So I think this story is very special. When I think about persons that I worked with, it comes first to my mind. The other boy, Maciek, lived in Krakow and he suffered from genetic disorder. It was mucopolysaccharidosis type 3A called Sanfilippo. And in this particular disease, one of the enzymes is not activated in the brain, it's not active. So the cells cannot remove the rest of metabolism. And those substances cause damage. When the mother of Maciek checked the level of enzyme activity in the brain, it was 0. After half year of the therapy, the test showed 40% of the norm. And there was absolutely no cure for this kind of disease. So it also shows how big progress we could achieve with neuroreflexology. In both cases, the big role played parents. I taught parents of Maciek to work every day with the boy, and after half of the year, so we could count that it was more than 150 days of work, of everyday work, they had this result. So I'm not promising the result after a week, after a month. It needs a lot of work. So the character of this method, we could say this is a kind of rehabilitation. The other case I will mention, and the last one, was Christopher from Bristol, from Wales. When parents came with him, he was totally paralyzed. It was quadriplegia. After a year of the therapy, I had a message from the parents. It was a period of Christmas. The boy was able to stand by the Christmas tree with his father. The legs were braced, but he was able to stand. After next month, I saw on Facebook the photo of Christopher on the bicycle with 3 wheels. If we think that he wasn't able to move at the beginning of the therapy, that it was quadriplegia, it shows how big efforts we can achieve. What is great about Temprana reflex therapy is that it could be combined with any other methods of classical medicine or alternative medicine. There is no problem to use something else while I work in my place with the child or adult person, or when parents work with their children at home. Maybe I will mention also about the courses for parents, because this is really not very complicated, and all parents that I worked with, they were able to work with their children. Of course, I'm observing what they are doing. I'm asking them for repetition of every movement. The materials are colorful, not complicated. There is no theory. It's only practice that I want the parents to do and to perform perfectly. And I am very patient during the courses, but I need precision. And of course, if you want to achieve results, it must be done very well. If you have any inquiries about the method and about my experience, please visit my website, temprana.pl. It's in Polish, but now we can use great technical methods, so there is no problem to translate texts in internet. So just look there, you can watch films, and in case of any questions or doubts, don't hesitate to call me on WhatsApp or write email or contact me through Messenger. I think the method is great and you could achieve a great result if someone of your relatives, maybe child, needs help. Try this method. In every case that I work with in my place, in my cabinet, or the parents worked with their children, we observed improvement. Sometimes it was not so big, sometimes it was very impressive, but in every case we observed improvement. Thank you for your attention.